When you're an endodontist, do you all do the procedure the same? And the reason I ask that is because you say bioceramic, and it does make me question, well, what material is in there? Now, I'm not going around worrying about it, and I won't. And having said all of that, I also do worry a little bit when people say, don't worry at all, everything's great, we use this bioceramic. I'm a doctor. As a scientist, I do have to ask the question, what is in that actually that's going into that space? Because I imagine it's not consistent all the time.
When I mentioned bioceramics, that's fairly new, around for maybe the last 10 years. You know, that there are some bioceramic implants, knees, hips, that they're finding are more effective. The standard filling for root canals is gutta percha, and that, again, has been around for over 100 years and is very biocompatible. We like to say that gutta percha won't hurt you. The safety of root canals is very consistent. You know, we like to claim success rates of 95%. Now, the alternative that they tout is extraction. I look at somebody like you, Dr. Travis, and I think that, you know, if you were to have those two front teeth removed, that would be a disservice to your health, because you know, to get teeth removed or an implant placed, implants don't last forever either. So we always advise people to save their natural teeth as long as they can.
There's not much I have left of my two front teeth. It's like a little stub and two big crowns over it. And I will say this before we close this topic. I think viewers need to be very cautious whenever they watch a documentary or film where the claims are so extreme that it begins to feel like there's an agenda. And I don't...
I think that, and then I think, moreover, anytime you have something that only focuses on very emotional situations for people, people with cancer, people with chronic disease, where they feel really hopeless and they don't really know why it's happening, I think that's where that type of exaggeration can really be distorted and be problematic, where they're twisting the science with an agenda, like you said.
I agree. I want to ask you, when you counsel patients, what potential complications do you discuss?
But I always tell patients that sometimes the treatment doesn't work. Our intent is always to bring teeth back to full function and have them last a lifetime. I've had root canals. In fact, I lost one of the teeth because I cracked the root, and I'm going to get an implant for the tooth. But I'm glad that I kept that tooth for the 26 years between the initial root canal therapy and when it had to come out. Now I'm going to my local orthodontist for Invisalign and getting my teeth straightened.
You too? Dr. Taylor, I'm doing it right now. Compare my teeth to last year. They're straightening up. Yeah. Hey, Dr. Taylor, thanks so much. I want to move on. But folks, don't ignore your oral health. It's so very important to stay on top of it and see your dentist for regular cleanings, exams. Of course, every day, make sure you practice good oral hygiene. You see how much straighter my bottom teeth are? I still have the little brackets on, so it's so exciting.
That your teeth are shifting? Is it really painful?
You know what it is it's great. It's so fun every time you want to have a cup of coffee to pull them out, and you're at a restaurant getting ready for your meal, you pull them out, and of course saliva comes out with them.
Are you that person?
It's very sexy.
Are you that person who does it at the table? Look at her face. You don't go. You're that guy.
I am so tempted to go grab them and wear them while I watch this show. So you want me it's all day, every day. They're in and out constantly. You want me every single time to say, excuse me. What looks more bizarre? Going over to the corner?
To the restroom.
Hey. Yes, I do. And I realize it's not very cool, but yes, I do.